So our current topic was a press release from the admirals and generals from the Army, and it was September 26th of this year. And it was too fat and unfit to fight is what they were claiming. And what they were blaming was junk food as the blame selling to our young kids. So our current topic will segue into talking about the obesity epidemic with children and what some things that can be done, particularly revolving around the thought of the military and our defense. So what happened? So we see here down the right hand corner World War II. That's what the typical Army recruit looked like. So now present day up above, and it's clearly about a 50-pound heavier increase, and it particularly looks like bigger waist sizes are the biggest part. So mission readiness, the retired generals and admirals of the National Security Organization came to arms with General Richard Myers, and who was the chairman of the Joint Chiefs Staff from 2001 to 2005. What he said is the latest research by the Department of Agriculture states that students consume 400 billion calories of junk food sold at school each year, almost 2 billion candy bars weighing almost 90,000 tons. This could circle the Earth more than 6 times. So not only the weight problem, so weight when combined with other disqualifying factors like failing to finish high school or being convicted of a serious crime, an estimated 75% of Americans aged 17 to 24 are not able to join the military. The issue is that obesity rates among children have dramatically increased in the recent decades. Being overweight or obese has now become the leading medical reason why young adults cannot enlist in the military. The Defense Department estimates that 1 in 4 young adults are too overweight to enlist. And as we see here from the CDC, here's a rising obesity among U.S. children and teenagers, categories of 2 to 5-year-olds, 6 to 11, and 12 to 19. It's pretty steady from 1971, 1974, and also 1976 to 1980. But after 1980, there starts to be this change of slope, an increase in the obesity percentages, particularly if we look at the 6 to 11-year-olds, and it seems like, and also the 12 to 19. So the trend in obesity among children and adolescents aged 2 to 19 years by sex now in the United States, 1971 to 1974 through 2009-2010. The other graph told us total amounts, boys and girls, but here now we have the slope and the change from 1971, 1980, pretty steady again. And then there's that sharp rise that we see in steady slope increase. And then it seems like 1998, a big jump and a change in slope again, particularly for boys. Boys seem to be climbing higher than girls, and girls slightly dip in 2009 to 2010. Again, this is from the CDC. So now we'll break it down in the prevalence of obesity among boys and girls 12 to 19 years, now by race, ethnicity in the United States, from again 1988 1994, comparing to 2009 2010. And for boys, here on the left, we can see that the largest increase was among the Mexican Americans, and particularly from 2009 to 2010. And for the girls on the right, we can see now it's the non-Hispanic blacks compared to non-Hispanic whites and Mexican Americans. And again, this is from the CDC. So, also being overweight coupled with lack of physical activity are leading causes of injury in the military, and one of the leading causes is dropout, and also a big cost to the military because they have to rehabilitate these people back. So we know that we see here ankle and foot and knee and leg issues are the biggest percentage of injuries. And we know that being overweight combined with again, yes, probably overuse in the military, they develop these lower leg injuries. So with children also, the complication of childhood obesity is multifactorial. It's not just being overweight. There's the psychosocial with poor self-esteem, depression, pulmonary with the asthma, renal, gastrointestinal, musculoskeletal, bones, joints, feet, even hernias, and also stress to the endocrine system. We know that type 2 diabetes is on the rise with young children as well. And then also developing early on cardiovascular disease, hypertension, chronic inflammation, and at a greater increase of coronary artery disease. Also neurological and pseudomotor and cerebral, and risk of stroke. So here we have an image of kind of like the cycle. It's kind of like a cycle of childhood obesity. And at the top, it's a healthy child, but then they start watching television, eating chips, and as they say, all study, no play. But while they study, they're munching. And then they become mildly obese. And mildly obese children don't like to take the stairs. They're not very good at things. So they gain this extra 10 pounds, which inhibits movements even more at moderately obese child. So the extra 20 to 50 pounds excess, it makes exercise uncomfortable, and also the risk of the other kids picking on them and self-esteem. This becomes severely obese here up in the red, and then cycles up to an obese adult with coronary artery disease, diabetes, pulmonary disease, high medical bills, and early mortality, asthma, diabetes. So some of these things too, as they become adults, is what the military is looking as for recruits, and they don't make very good recruits. So what is the current state of obesity in America? So here we have a little bit of a busy slide, but some of the key points here is saying who's obese. So males, there's 26 million. Females, there's 34.7 million. All right, and if we see the soda here, and we think about the percentages of obesity, and U.S. is ahead of Mexico, UK, and Slovakia, and also Greece. Then 8 out of 10 children who are overweight at the age of 10 to 15 will be obese adults. And then 36% of people with hypertension are obese. 19% of people with cancer have some obesity-related forms of disease. And 46% of people with type 2 diabetes are obese. And some of the factors can be medication, diseases, environment, and genetics. The cost to Americans, the total is $117 billion a year. That's why retired generals and admirals like General Richard Myers are calling our leaders in Washington to help reduce the junk food sold in schools. They proclaim that too many schools still have vending machines and other venues where children can routinely buy candy, potato chips, cookies, sugar-sweetened fruit juices, or sport drinks.
Wondering why childhood obesity is running rampant? It is also speculated by the CDC that children consume as much as half their calories. The retired generals believe that if parents adult, the problem was that many parents began sending their children. The retired generals posed the question of how we get. There is now strong evidence that replacing junk food with Washington Post writer Rob Stein reports other school districts, including Philadelphia and it is thought that some of the explanation. Most importantly, the city has implemented. How may we succeed in teaching our children to eat? The retired generals and others. The USDA is now working on reducing junk food.
Several of the interventions that reported positive effects on BMI or other measures of adiposity. So Planet Health focused on changing 4 key behaviors: increasing consumption of fruit and vegetables, decreased consumption of high-fat foods, and decreased TV viewing, and increased physical activity. And BMI is the body mass index, which we know is a person's weight proportion to their height. More than likely, if someone's gaining weight compared to the height, it's body fat and not so much muscle unless they're exercising. So SMART, another program focused on single behavior, that's screen time, which included time spent watching TV and video playing games and playing games. Also, 2 interventions to reduce cardiovascular risk. There was the Catch and Know Your Body. This targeted broader objectives, such as reducing intake of total fat and then saturated fat. These goals suggested a possible benefit to increase behavioral changes for specific activities of food consumption. For example, watch less than 2 hours of TV a day or eat at least 5 fruits and vegetables, which should be the focus of school-based interventions. However, as we know, like the NIH, they suggest that we look at the data with a critical eye. Most of the data was influenced or could be influenced by dietary factors on overweight, which may have recognized the weakness of dietary assessment methods, particularly self-reporting in regards to children and adolescents. So we always want to look at the data critically and beware that there could be some errors, but the trend would be pretty specific, and most, if not all, of the data research shows that overweight in young adults is rapidly increasing and putting our military and our civil defense at risk. Because who will become the recruits and what will happen?